Well, good afternoon, Springford, and welcome back to the weekly update. It's good to be back. We have with us Erin Crew. Hi, Erin.
Hello, how are you?
We're great, thanks. Just today's episode is going to be about talking about our updated practices as is recommended by the Montgomery County Office of Public Health and the Children's Hospital of Philadelphia. So we're going to do this sort of in an interview style. So Erin will kind of be talking me through the various aspects that could be changing and those that are going to be staying the same. So we encourage you to watch the whole video and share it as often as possible. Erin, go ahead.
So let's start with some questions we have about how we're going to be communicating and what we will be communicating. For the last year and a half, we've sent information to families about classroom notifications, and that notification goes out to anybody in a classroom, just sort of very basic, giving you a notice that your child may have been in the same room as somebody who tested positive for COVID. It's not the close contact notice, but the classroom notice. And in that notice, we encourage parents to monitor their children for symptoms, keep an eye on them, keep an eye on their health, and all of that information. So what came out of the board meeting last night was that we would no longer be continuing the classroom notification. We will still continue the close contact notice. That's changed a little bit on our end as well in terms of how we go about doing that. But can you talk about the classroom notice and the guidance we're getting from the county and why we're moving to step away from that classroom notice?
Sure. So I think probably the primary point here is that Montgomery County and CHOP are really working hard to allow their practices to evolve to meet the needs as COVID has shifted. When we first started doing the classroom notification back in, I want to say around November of 2020, that served a purpose at the time. It met a need, and that was to inform us that there were cases in our building. As we've gone through the many variants that have come from COVID, Omicron, we're finding it's all around us. It's in our community. And when I say we, I mean Montgomery County as well as CHOP and here at Springford, we are encouraging parents to regularly monitor their children for symptoms, have children, talk to them about what COVID symptoms look like. If we're sick, stay home. And that should be a regular discussion in the household to make sure that we're constantly staying on top of what being healthy is while we're working through this Omicron variant and moving forward in the pandemic. The classroom notification piece has become really less necessary. And what we have found that it has done is inundated parents' inboxes with emails. And then when really relevant emails that require response from parents, when they come to the inbox, sometimes they're missed. And we really want to make sure we streamline our communication and the parents are getting what they absolutely need, and we're not unnecessarily overwhelming inboxes with notifications. That's the idea behind it anyway.
So we'll continue to send those reminders to parents in weekly update to monitor their students for symptoms anytime throughout the day or even the course of the year. Eventually when we get to summer, we'll still want to be keeping an eye on symptoms as they're taking place outside of school.
And for parents that have questions, we still have the hotline that we started up that parents could reach out to, and that hotline goes to our school nurses.
And I'll put that right above us here. There'll be a little ticker tape of the hotline number, the COVID hotline. So today will more than likely be the last day of classroom notification going out. Parents will probably get an email towards the end of the day, probably after weekly update and this video goes out. So going forward though, after today, they will no longer receive the mass classroom notice anymore.
That's correct. There will be no classroom notification moving forward. What that means is when you see something from the school district that references COVID, that is most likely a close contact notification. And we do want you to read that, and we do want you to respond if you find your child's in that situation.
So let's move into talking about the close contact notification. And while you're starting to say, I'm going to pull up that email so that we can take a look at it together with our school community who maybe hasn't seen it yet. So as you mentioned, parents are going to want to look for any email referencing COVID as something important to open. So when they receive that close contact email, the subject will be SFASD, close contact notification, parent action required. Let's talk about what that parent action is as we go into this new way of tracking close contacts. Can you explain to us what we should be expecting when we get those notices?
Sure. The close contact piece has become a little bit daunting, so we've divided things up a little bit. So our in-school close contacts are really being managed by our administrators. They're going through doing the close contacts, and then that email is going out once a day at the end of the day. So whenever you get that email as a parent of a child who's a close contact in school, we are really, in that email has the dates, has all that you need to know in terms of what your quarantine would look like. It also has a link to a Google form where we're asking you to let us know what your intentions are. There are options for you. So to be considered for an exemption from quarantine, or even the mask to stay option, your child has either tested positive for COVID within the last 90 days, your child has been fully vaccinated, or on the date of exposure, your child might not have been in the building and therefore not been in the vicinity of that of the positive case.
So what happens now is a parent will receive an email from the school district, the email address news@spring-ford.net. Again, the subject of the email being close contact notice, parent action required. And in that email, there's a form for parents to complete where they identify if their child falls into one of those three categories, or if they will be staying at home to quarantine or participating in the Mask to Stay program. And that email is important for parents to read and then fill out that form so that our schools know what will be happening with the student before they return to school that next day, if they're returning to school, or if they'll be home for the remaining days that they would need to be home. And then it does include in there that mandatory mask expiration date. So to participate in returning to school, they would have to remain masked for 5 days after that end date. And for us right now, we are required to be masked while in high, so that mask date isn't quite as important as it will be once we start to transition into the substantial, moderate, and low categories. Hopefully sometime soon, we would certainly hope. So we will still include those mask mandate dates in the letter as well.
Absolutely.
So that takes us through the stepping away from classroom notice, the close contact notice change, and what parents should look for going forward. Let's talk about, because we've said it a few times, the Mask to Stay program, which will be new for us here.
That's correct. So Montgomery County and CHOP work together on devising another option for schools. And again, recognizing the value of in-person learning, but still making sure that we're taking appropriate safety steps. Mask to Stay is an alternative to quarantine. And again, this would be an option for our families, not a requirement. Families can still quarantine if they choose a quarantine, but if they want their children to be in school for learning, the Mask to Stay program might be the right fit. So what that essentially means is if you're identified as a close contact or positive, then you have the and that would be either in school or in the community. If you're a close contact to a positive, then you can participate in a program where you still continue coming to school. And then for 10 days from the date of exposure, you are required to wear a mask in all settings. One caveat to that is on either day 4, 5, and 6 of your 10-day mask to stay period, you would need to take one Binax rapid antigen test to verify that you're negative. If, of course, you become symptomatic or if you would test positive, then you would then go into an isolation period of time.
And you did mention this, and I think it's important to point out, you mentioned this is for students who are identified as school or community close contacts. There's a third category there as well, which is a household close contact, which is entirely different. And household close contact would be if a student or a child is a close contact to somebody who lives with them in the same house and they're positive. Totally different situation than community, where you might pick it up at a rec league or out at a movie, or school close contact.
Correct. And the thought behind that is in the household, the ongoing exposure to somebody who has tested positive for COVID. So the quarantine piece is still in place. Mask to stay is not an option for household close contacts. And again, it's that ongoing exposure. Now, there are timelines that are involved, and if you're able to isolate the positive case from the rest of the families in the household, then there are options to come back from quarantine earlier that we have practiced, and that hasn't changed. But as far as masks to stay, that is not an option for those that are household close contacts.
And then when will we be starting the Mask to Stay program?
Our goal is to start the Mask to Stay program beginning on Monday, January 24th.
So that all of this information, in addition to being in this video, will be in Weekly Update. We'll update the website with this information, and we'll link to the Office of Public Health's document. It explains in great detail the Mask to Stay program. And finally, what we have on the list, because there are some changes, there's some stuff coming, there's some stuff going. Can we just review quickly what is still in place, what we still have here, what remains here at Springford when we talk about COVID?
Sure. So one of the things that hasn't changed is how we treat a positive case. So since we came back from break on January 3rd, Montgomery County did update their guidance to say an isolation period now is 5 days and then 5 additional days of masking, providing that you are symptom-free or you're on your road and your symptoms have lessened and you're fever-free, you're afebrile. So that hasn't changed. That's been in place since January 3rd, and that is going to continue. The way we treat household close contacts hasn't changed. That's still the same. We're staying in contact with Montgomery County to see if there's going to be any updates there, but at least at this point right now, that it hasn't changed as well. Those are probably the big ones. And notifications. We are still notifying families when they are close contacts. The way we do it might change a little bit, but we're still notifying families of that close contact.
We do still have masks while in high transmission level. That hasn't changed. So we're still masking up while we're at school and on school property here. And we do still have the Tuesday, Thursday test clinic. We have received some updates from the crew over there doing that work, really encouraging people only to participate if they are symptomatic or have been identified as a close contact. Not so much to use it as an assurance test, or they have seen people who think that a negative test is needed to return to school. That's not the case. Because this is funded and supported by Top Policy Lab and they're providing the tests, we really want to make sure that we're responsibly testing people. So our test clinic individuals have put the plea out to please make sure you're either symptomatic or a close contact to be able to continue to provide this to our community, our students and staff here.
Yeah, we're just thankful to be able to offer that program. I have heard stories of families having a hard time getting access to tests, and this is a great, fast way to get it done right here in our footprint.
Yep. And again, it's for our students, current staff members, parents, siblings who are not current student or staff here at Springford. They can always use the Montgomery County community test sites, which are really great, very fast. I've been checking regularly, and they do have open appointments. It's about 24 hours, 48 hours to get those results back, but a really nice streamlined process there as well.
Yep, great.
Great. Thanks for having me on again.
Well, hey, anytime. Glad to have you on with us. I want to thank you all. That ends our update for this week. Stay tuned for next week's update. Have a fantastic day. Stay safe, and we'll see you.